Ibovan, and a very good evening to all our viewers here on TV1. I'm Dr. Dilshan Fernando, and this is your weekly dose of wellness here on Healthline. Today we are going to be focusing on an organ that we haven't focused on before here on Healthline, and it is none other than the largest solid organ in the body, which is the liver. And when we say liver, a lot of people may think about cirrhosis, hepatitis, but today we are going to be talking about a condition that is even more prevalent and may lead to certain complications as well. So, to talk about this condition, fatty liver disease, it is a great honor and privilege to welcome back to the Healthline studios Dr. Isurujith Liyanage. He is a consultant gastroenterologist and hepatologist, and also a lecturer at the Sri Jawaharlal Faculty of Medicine. A very good evening to you, sir, and thank you for joining us back here on Healthline.
Good evening, and it's a pleasure to be back.
So, first and foremost, sir, what is fatty liver?
Right. So, as the name, the word implies, fatty liver means excess fat in the liver. So, liver is a kind of in a way, it's an extraordinary organ. It has a huge variety of functions, which is the reason why we cannot replace the liver's function like we replace the kidneys work by a machine. So, one of those functions is to process the food that we eat and redistribute it, and it also has a function in storing some of these things, and fat being one of them. So, when the liver cells store fat, and in some people the fat that is stored is in excess, and that excessive fat can cause damage to these liver cells. So, in fact, these liver cells will die with excess fat being present inside that. So, that is the condition that we call fatty liver.
Right. Now, there may be a misconception amongst our viewers that fatty liver only occurs in obese people. Is that so?
It's not. So, there are a lot of misconceptions around the concept of fatty liver across our viewers. One of them is that it is only it occurs only in obese people. Now, first of all, we need to understand what happens there, and what happens is when the energy in our body is in excess, this energy is converted to fat for the purpose of storage. So, irrespective of how you take the energy in, so there are food items that are called energy rich food or energy deriving food. Those are namely carbohydrates, that is rice and breads, etc., and then fatty food, and also glucose. They will, when we internalize them, and the total amount of energy that is within our body is is in excess to what is required, the body, irrespective of what you ate, body converts them to fat to store, and that it is that fat, some of that fat is what is get deposited in the liver, and which leads to this condition called non-alcoholic fatty liver. So, it comes to the point where when you get this, and what are the other instances where you get fatty liver. Now, the concept of non-alcoholic fatty liver comes in because there is alcoholic fatty liver. So, when we take in excess alcohol, again what happens is that alcohol is detoxified in the liver, and that also leads to increased production of fat, and that fat is deposited in the liver cells, and that kills the liver cells. That is how you get liver damage with alcohol. So, in other terms, alcohol, excess energy in the body, all of that will lead to the condition called fatty liver. And going back to your question whether you have to be obese or fat to have fatty liver, it is not. It comes with our genetic makeup. So, some people, as I am sure all of our viewers had seen, there are people who are very obese, but they do not have any issue, they do not have diabetes, they do not have blood pressure, they are quite all right. But there are some people who are very not very obese, but they have a bit of a tummy, and then they get slightly overweight, and then they end up getting all these problems. So, there is a genetic predisposition or a tendency, and when you are at a higher risk, irrespective of your body size, you can have these conditions.
Right. So, if I may recap what Dr. Liyanage just said. So, fatty liver disease can be divided into non-alcoholic fatty liver disease and alcoholic. So, when we talk about non-alcoholic fatty liver disease, it is basically due to the excessive intake of food which get deposited in the liver. Now, when we talk about this fatty liver disease, how common is it?
It's very common. It's so common that everyone whom we meet would have, lot of people would have had a ultrasound scan which says they have fatty liver. I think we'll have to discuss about that in a bit, what are the things that we need to do to test, but it's quite common, especially in our part of the world, because we are at a higher risk due to our genetic makeup and our changed lifestyle and the dietary pattern. We are at a higher risk. So it's common. We don't have exact figures, but we estimate roughly in about 1 in 3 of all people would have some degree of fatty liver.
So that seems to be a very significant figure, 1 in 3. So, and you keep talking about this genetic predisposition. So if a first degree relative has had the condition of fatty liver, does it invariably mean that they would also get it?
Right, that's an excellent question. It's not essential. It's like diabetes. It's like high blood pressure. It's like heart disease. So in fact, all these diseases come in the same root. They have the same genetic risk. And when you have, so we call that metabolic risk. So when people are at this higher metabolic risk, they are at a predisposition. Not that they essentially get it, but they have a higher risk of getting the disease. So in other words, the positive side of it is that if your relatives have had one of those metabolic diseases, you still, it's not that you'd necessarily get it, you can safeguard yourselves, but you have to be careful. So you are at a higher risk. And in other words, they are what we call multifactorial diseases.
So now we spoke about these metabolic diseases, and that brings us to a very important juncture with regards to fatty liver and all this cluster of diseases. It's called metabolic syndrome. So if you can elaborate a bit for the benefit of our viewers, what is metabolic syndrome and what does it entail?
So metabolic syndrome is again a derangement in our body's metabolism, where there is an imbalance between again it's mainly to do with the energy. When our energy consumption is in excess to what is required, it is stored in different ways, again not just in the liver but in other parts of the body as well, and you have an imbalance in the body composition. You have higher fat than what you should have. So what you should have is not what another person should have. That is where the genetic predisposition comes in. So some people cannot tolerate that fatty tissue, and that fatty tissue is actually metabolically active. They secrete hormones, etc., and they will cause certain changes in your body, and that leads to increase, or rather the fat deposition itself leads to increased obesity and fat deposition, and that fat is deposited in a certain way, especially around the belly of males and around the hips of females, and then that increases the waist circumference, and that increases the risk of hypertension, high blood pressure, high cholesterol, and then insulin rather what we call glucose intolerance, and later on diabetes, and they just come as a cluster of disease. And the topic that we're discussing, fatty liver disease, actually is the hepatic or liver manifestation of that cluster of diseases. So they would all, so when you have fatty liver, you are at a higher risk of getting the others, and vice versa.
So for a person who has a strong family history of one of these conditions that we spoke about that is involved in this metabolic syndrome, is it worthwhile for them to get a regular screening done, and if so, how often?
Right. There's no hard and fast rule. There's no guideline as to direct people to kind of check without having the disease at any point, but I would say the same guidelines that we tell adults when they are more than 40 years or 30 years imply on regular checkup. So I think a good guide would be if someone of the previous generation has had a problem, let's say a heart attack in their 50s, it's always good to start getting yourself checked and being conscious about your health 20 years before. If someone parallel to you in the same generation, then probably about 5 years before the onset of that person's problem, it's good to be conscious of health and get yourself tested. It's always good to get a doctor's opinion, because depending on where you stand, the frequency at which you need to test or screen differs. So there's no hard and fast rule.
So, it's important that our viewers understand not just fatty liver. I mean, we spoke of so many conditions: heart disease, high blood pressure, diabetes, fatty liver. So, all of that comes in one cluster, and if you have one, you might be prone to the risk of developing the others as well. So, and also if you have a strong family history, it might be worthwhile to follow up with a registered medical practitioner, so that you can keep an eye on things, and always they say prevention is better than cure. So, moving on with our topic of discussion, you spoke about fat deposition around the belly and the hips. Now, we see as Sri Lankans or Asians, actually South Asians, we are more prone towards what we call the central obesity. So, are we at more risk compared to let us say Europeans or Americans to develop this fatty liver?
We are, but again it's not proven on paper, but we are at a higher risk when it comes to the other metabolic diseases, especially diabetes, high blood pressure, cholesterol. This is because of we are not really catered for that high energy food consumption without expenditure. So, the change in our lifestyles affect us more than Europeans, and our pattern of fat distribution, as you mentioned, is more towards the belly and the hips, which are unhealthy areas compared to our counterparts Caucasians. So, it's always good for us to be extra conscious, concerned about our health more than the Westerners.
Now, you spoke about how we are not catered to take that excess energy. Is it a part of our evolutionary process or genetics? How would you go about elaborate on that?
Right. I honestly don't know the answer to that question, but I presume it's a mixture of all of that. It's definitely something to do with evolution and our genetics, and also the change in lifestyle, because we are living in a very hot part of the world, and our basal energy consumption is not as much as them, and the dietary pattern that we've got used to and the lifestyle that we've used to is different, and there's a drastic change in the recent past, and all of that probably contribute to it.
Right. Now, we see that certain diseases, there's a gender predisposition, where certain diseases males are more prone to get it, and certain where females are more prone. When we talk about fatty liver, is there a gender predisposition?
Right. Again, and it's a very interesting question. It's so we have in Sri Lanka, there's a few studies that have been conducted that shows that metabolic diseases, diabetes, high blood pressure, are in fact commoner among females, which is kind of the exact opposite of what is observed in the other parts of the world. So, for fatty liver disease, whatever that is available is probably equal in both the genders, but when it comes to now, there's an entity called dual etiology liver disease. That is when, now as I mentioned earlier, alcohol causes the same problem. It leads to fat deposition, and this energy imbalance and increasing kind of taking too much of food and kind of not being regularly exercising, that increases the same. So it leads to the same thing, and that leads to that the liver gets damaged in two parallel mechanisms, and it ends up in the same place. So that leads to not really, we used to tell people it's not 1 + 1, it actually increases the risk of liver damage in about 6 times. So that leads to a condition called dual etiology liver disease, where you take a little bit of alcohol, you might not even be reaching that kind of high risk drinking level, but with that alcohol intake and the predisposition with non-alcoholic fatty liver disease, you end up getting more liver damage. So in that context, complications of fatty liver, I presume, are more commoner or rather common amongst the males.
So, if I just may recap what Dr. Isurujith Liyanage said about this dual etiology. Now, if you are already having non-alcoholic fatty liver disease, on top of that, if you are taking even a little bit of alcohol, now we talk about these numbers of units which are safe to drink, but in these patients, I presume that these units don't really matter.
Yes, so these units do not matter in these patients. Even a little bit of alcohol can cause more harm than it would in another person.
Right. Now, when we talk about a disease condition, we always talk about symptoms and signs. but fatty liver disease may be a little bit different than the others. So, can you elaborate on what possible symptoms and signs and when these symptoms and signs might develop?
Right. So, that's an interesting topic, because liver, as I mentioned, is a really extraordinary organ. It has very much of an excessive capacity. It can actually accommodate for 3 people. So, until the liver is damaged beyond about 60 to 70%, you will not have any symptoms due to liver impairment, which is why even when you take alcohol, we keep on taking until the last moment, by which time you feel anything, it's too late. It's fatty liver, the same story applies. So, until your liver is damaged to a level where it's irreversible and it is kind of too late, you will not feel anything, and it's literally asymptomatic. However, some people will have kind of a more hastened liver damage, that is called, we call that non-alcoholic steatohepatitis, when the liver cells damage a bit more faster than a normal person, and in those people you can have a little bit of discomfort in their right side of the abdomen, and they can also feel a little lethargic, tired, and they might lose a little bit of their appetite. So, those are features of liver cell injury happening at an excessive capacity, but it is lot less common. So, in the fact that you do not have any symptoms does not mean that you do not have fatty liver.
So, that brings us to a very important but little bit scary juncture, where patients might not know that they have this until it's irreversible. So, let us talk a bit about how we diagnose this condition, and there are varying degrees of fatty liver as well. So, if you can just elaborate on that.
Yeah. So, fatty liver is not, there is no single, so actually there is a single test. The definitive way to diagnose fatty liver is to take a part of the liver out, look it under the microscope and quantify the fat. So, that we can't do on all the people that walks around. So, what we do is we screen people who have metabolic risk factors. We do liver tests, as in blood tests, to see if there is evidence of ongoing liver injury, and also we use the ultrasound scan. But I want to make it very clear to our viewers, this grade that is given in ultrasound scan is not something that we use clinically. It's been used some time back, but it is not really used to see how severe, because we see a lot of patients who would say I have grade 2, I have grade 3 fatty liver, but as liver doctors we don't use that to for any of our clinical decision making, but we look at the extent of ongoing liver injury based on liver tests, on blood tests, and we also see how much of the liver is damaged. So, that liver damage is called fibrosis. So, what happens is, when every day a little bit of the liver is damaged, the liver cells that die are replaced by what we call scar tissue. That is same tissue that we get in a scar when we have a big wound. So, this scar tissue accumulate in the liver through a process that we technically call fibrosis. So, when that fibrosis exceeds a certain limit, that is when you end up, we get the condition called cirrhosis. So, we estimate the degree of fibrosis. There are variety of blood tests and also certain scans that we use. One scan is called the fibroscan. So, we check people to see if they qualify to have that scan, and we do that scan, and that tells us whether there is ongoing liver damage and whether there is a kind of significant amount of fibrosis. So, that is how we estimate the extent of liver damage.
Right. So, if a patient goes to get an ultrasound scan for some other reason, and the report might say that he or she has a certain degree of fatty liver, does that indicate that they should consult a hepatologist such as yourself, or what kind of precautions or measures should they take if they do come across such ultrasound scan?
So, that kind of a scan is very common. So, all of them should not consult a hepatologist, because then hepatologists will not have any other work to do. So, what they need to do, however, is to consult their doctor, a general practitioner or any other registered medical practitioner, and get themselves checked, not just for liver disease, but for all the other metabolic risk factors. And if their liver tests are deranged, the blood tests are deranged, then that is the time they need to see a doctor to discuss it and to see whether they require or they qualify for medical treatment, and also what lifestyle changes that they need to make.
And again, now we are coming to a very important juncture in our discussion about lifestyle changes and medication. First of all, let's discuss what kind of lifestyle changes that we can advocate for these patients who have developed early stages of fatty liver.
Fatty liver, right. So, something that I tell all my patients, now let's assume that you have another medical condition, diabetes or high blood pressure. So, in those patients, the cake is the medicine which is the mainstay of them getting better, and their lifestyle change is merely the icing. I am not saying it is not important, but it is something that adds on to medicine. But when it comes to treating fatty liver disease, cake is the lifestyle change and the medicine is merely the icing. So, the lifestyle change, whatever the degree of fatty liver disease, the most important thing is lifestyle change and finally achieving weight loss, irrespective of your weight. So, lifestyle changes and these changes are threefold. One is they need to be careful with their diet, and that is very simple to do. What we need them to do is to reduce their energy intake. There are so many apps and nowadays people are very educated and they have access. So, if you just go through, if you Google and see how much of calories that you need to take and look at the number of calories that are present in different types of food that we consume, and you limit your calories or rather reduce the calories or take less calories than what you need, you are obviously going to lose weight. So, that is how you be careful.
So, basically maintain a calorie deficit.
Exactly, spot on. So, caloric deficit. Number 2 is exercise. Exercise, I have to emphasize, will not help you to lose weight, but it makes your balance between fatty tissue and non-fatty tissue healthier. And exercise, we recommend at least half an hour a day, at least every other day, that is 4 days a week, and at least a brisk walk, and that is exercise, and then staying active throughout the day as much as possible. I think we have talked about this quite a bit. Use stairs, don't use lifts, walk as much as possible, and all the other things that we keep on telling in different places. So, the second thing is that. Third thing is to lose weight. So, when you have fatty liver, we recommend them to lose at least 5% of their body weight. So, if you have 50 kilograms, you need to lose 5, and best is to lose 10% of their weight. So, those are the 3 pillars of treating non-alcoholic fatty liver disease.
So, like Dr. Liyanage says, in non-alcoholic fatty liver disease, lifestyle modifications is the cake. It is the mainstay of treatment. So, control your diet, exercise, and make sure that you stay active, so that you can try and prevent further complications that may occur if this fatty liver increases. So, which brings me to the question, undiagnosed, untreated fatty liver, non-alcoholic fatty liver, what complications can it cause?
Right. So, that is the most important thing that our viewers should know. So, non-alcoholic fatty liver disease, now not all the people with fatty liver disease will have complications with regards to the liver. Only roughly about 20% of them will have liver related complications, and when that liver injury goes on, it is not going to happen overnight. It takes 5 years, roughly 5, 10, 15 years. Across time, when their liver reserve reduces, they end up getting cirrhosis, and cirrhosis is a separate topic of discussion, but has a lot of complications, and that is a lethal condition. Second thing, 80% of these patients they have complications with regards to the other diseases, cardiovascular mortality. So, they have a higher risk of getting diabetes, high blood pressure, high cholesterol in the first tier. Second tier would be heart disease, stroke, kidney disease, and all the other complications of those diseases. So, that is the biggest risk that they have, which again brings them back to the lifestyle changes to minimize all these risk factors. The most important thing is to adopt a healthy lifestyle.
So, when we really analyze it, most of these metabolic diseases and lifestyle changes go hand in hand, and if you develop one, you are more at risk for developing others. So, it is very important that our viewers understand that maintaining a healthy lifestyle, having a healthy diet, exercising on a regular basis, this will not just help you prevent fatty liver disease, but it will give you so many more benefits in avoiding conditions like heart disease, diabetes, so on and so forth. Now, talking about complications, people might wonder, does fatty liver give rise to cancers in the liver?
Right. Now, first of all, when now assume that we receive a patient with fatty liver, so that appearance and that change in liver cells or the liver tests can be due to a lot of other reasons. So, we have to rule out other genetic diseases of the liver, and there are infectious viral diseases. So, the first thing we do is to rule out those conditions before we label someone as having fatty liver disease, because the same appearance, it will appear the same in the ultrasound scan as well as in the liver tests. So, those conditions can give rise to other complications. And then if it is fatty liver per se, as you correctly mentioned, it increases the risk of cancer. Not just in the liver, but in the rest of the body as well. Again, we are coming back to metabolic syndrome, which is running in circles around it. When you develop significant fibrosis, when there is, so that fibrosis is cirrhosis, when you have cirrhosis, you are at a very high risk of developing liver cancer, and liver cancer is one of the main modes or ways people with cirrhosis finally end their lives.
So, now you spoke about fibrosis and developing cirrhosis. So, when it has reached that level, is it not reversible? Can a patient with cirrhosis go back to having a normal liver function?
Right. So, generally when we learnt cirrhosis as medical students, we were told cirrhosis is irreversible. So, fibrosis process is actually irreversible because liver cells are in fact replaced by those scar tissue, and then there is no other way of us going back. But non-alcoholic fatty liver disease causing cirrhosis in the early stages are in fact reversible to a certain degree, and for that you need to lose 10% of your weight. So, the research says if you have lost 10% of the weight, early fibrosis or early cirrhosis is reversible, but it does not mean cirrhosis means a death sentence. So, cirrhosis or fibrosis is actually, it's a huge spectrum, where in the early stages people often die of something else. So, it's not something that if one of our viewers are told that they have this, it does not mean that it's really bad, but they have to be extra careful and they should keep on trying, because there is some degree of reversibility.
So, once again it comes down to losing weight and maintaining a healthy lifestyle, I believe. Now, in the present day, we see so many programs of detoxification. It is advertised far and wide on the internet and all these social media platforms. We know the liver is the main organ that detoxifies whatever that we take into the body. As a specialist in this area, I am sure our viewers would like to know whether these detox programs are actually beneficial, or will they in fact cause any bad effects on the liver as well.
To be very honest, we don't have evidence, so I cannot really say whether they work or not, because we don't have solid evidence on either. So, what I can say is there's no evidence for the time being on any detox program helping the liver, but whatever the program that you adopt, if you lose weight and if you sustain that weight loss, that is another thing that I need to mention. Now, when you mention detox programs, the first thing that came to my mind is doing radical things to correct this or lose weight. So, if you adopt some lifestyle, what you need to do is to ask yourself whether it is sustainable for the rest of your life, because for fatty liver and as well as for the other metabolic diseases, weight fluctuation is worse than maintaining at a high weight, right. So, weight you should not, because now when you do something radical, let us say you adopt an 18-hour fast and 6-hour diet. I know a lot of people who do that, and then so that on paper that diet has a lot of good evidence, but all those studies, when you take off the intervention, when you take off the strict control, they go back to their routine diet and they gain the weight, which is worse than them having maintained their higher weight. So, it's good if you can do that 18-hour fast, but ask yourself whether you can do that for the rest of your life and do that. Because whatever the change you make, it needs to be sustainable. That is the first thing. But then when it comes to liver health and diet and all the supplements, we are genetical, we have evolved over millions of years to have the current liver that we have, and that then the liver is capable of detoxifying what we are used to eating and drinking. So do not take anything in excess. So whether it's curry leaves, whether it's pumpkin or rice or anything for that matter, anything in excess may not be, I don't have solid evidence to say this particular thing is bad, but we have got used to eating certain food items in small quantities, certain food items in large quantities. It's always safe and healthy to stick to that ratios rather than changing that drastically, because we have not evolved to handle these changes.
I think we touched upon a very important topic there, because we see that certain drastic programs which ensure weight loss, but like Dr. Isurujith said, if you can't sustain it throughout, this fluctuation in your weight might have even worse effects than having an increased body weight. Now, since we are on the topic of liver health, I have to ask this from you. We have so many patients coming in with liver disease unknowingly because they have been using some Ayurvedic medicine. Especially we have certain practitioners out there who are not regulated and not registered. So, a word of advice on using Ayurvedic medicine, I think our viewers would benefit by that.
It's a very sensitive topic. I'm not, again, it's the same thing that I mentioned earlier. I'm sure qualified Ayurvedic doctors, they are taught just like us, and they are very learned and they are very experienced, and so what they prescribe, what they give, I'm sure has been tested, may not be on paper scientifically, but across generations.
If I may interject, now it doesn't necessarily mean that the practitioners what they prescribe might be harmful, but our patients might be taking those in excess without following the prescribed amount.
Exactly, so that is exactly where I'm headed. So if it is prescribed by a doctor and given by a doctor, qualified Ayurvedic doctor, I honestly don't anticipate any harm in that. But again, if you look at medicines, whether it is allopathic or Ayurvedic or what we prescribe, some medicines will have liver toxicity, but then we prescribe those medicines because the benefits are more than the possible potential harms. And then we need to monitor the liver. So we know what medicines will cause liver damage, and we will be monitoring these patients for this liver injury. When you take, irrespective of whether it's Ayurvedic or allopathic or Western medicines, that is one of the problems in taking medicines by yourself from the pharmacy or Ayurvedic products. You prepare them on your own. A good example is Karapinchak and that we make, and then when Ayurvedic doctor prescribes, we think it's made from leaves and a tree and it's healthy, and without medical advice we continue taking that. So that is what causes, I'm not saying curry leaves cause liver damage, I'm just using an example. I've seen a lot of people doing that so just like Western medicine, Ayurvedic medicines are also medicines, and they should be taken on prescription only and under guidance of doctors. You should not continue taking them on a long-term basis.
Exactly, that is one point that we continuously emphasize here on Healthline. Do not try to self-medicate, and even if you are prescribed something, stick to that prescribed amount, that duration. Don't try to overdo it. By doing that, you will be causing yourself more harm than good. So with that, sir, with the time constraints that we have, we are coming towards the end of this edition of Healthline. Now, with regards to fatty liver disease, non-alcoholic fatty liver disease, and in general the liver health, what would be your take-home message for our viewers?
Right. So the take-home message is, it is a multimodal, multifactorial disease, and you are at a higher risk if you have high blood pressure, diabetes, cholesterol in yourself or close family members, and if your body weight is not non-optimal, you are at a higher risk. And if you are at a higher risk, it's always good to get yourself tested, and if your liver tests are abnormal, you are at a higher risk of both developing liver related complications and other complications of metabolic syndrome. So, it is always good to change your lifestyle and also get medical attention and correct yourself, and it might, all these conditions are asymptomatic until you have complications, by which time it is too late.
Definitely, and with that message we come to the end of this edition of Healthline. Like Dr. Isurujith Liyanage said, be aware of what is going on with your health, because by the time you develop symptoms with regards, especially with regards to fatty liver disease, it might be too late, and always seek the attention of a properly qualified medical practitioner. So, I think we had an in-depth discussion about this condition, and we thank Dr. Isurujith Liyanage very much. Thank you, sir, for joining us here on Healthline for the second time. And with that, I take your leave from this edition of Healthline. Until we meet you again next week with your weekly dose of wellness, this is me, Dr. Dilshan Fernando, wishing all our viewers Ayubowan.